Part of the standard of care that we want to influence is if someone becomes dependent or addicted to these medicines that we write, that we don't make a big deal about it. That we, in a very non-judgmental way, treat the opioid use disorder, and the treatment often is Suboxone. We're going to talk more about the treatment of opioid use disorder over the following months and years. But what I can tell you is we have a problem in the United States. The data shows that somewhere between 2 and 3 million Americans have opioid use disorder, which means they're addicted to opioids. And often that's fentanyl, which we can now find on the streets, that's involved in colleges and high schools around the country. It's in every major American city. And when I first started tracking the data, there was about 6,000 Americans who died every year from overdoses to opioids. Today, that number is over 80,000 deaths per year, and most of that is driven by fentanyl, which is found on our streets. But many of these patients are coming through our clinics. Many of these patients are suffering from pain. When you're addicted to opioids and you take fentanyl on a daily basis, it causes you to have pain. When the medicine is coming out of your system and wearing off, you feel pain. And many of these patients will come to our doctors seeking treatments for pain, but their actual condition is opioid use disorder. One of the things that I want to normalize is accepting these patients and showing them love. The same way I talked about my daughter at Phoenix Children and how much love they showed her. I want to show that type of love to patients that come to us that are addicted to opioids. And unfortunately, the standard of care today, if someone comes to you addicted to opioids, is to say, I'm going to send you to an addiction psychiatrist and you're going to have to wait 3 months. And then when you're seen, it might be cash pay. Or the standard of care might be, I'm going to put you in an in-treatment program or in-house treatment program, and it's going to cost $30,000 or $40,000, and we're going to help you get off these opioids. Or I'm just going to kick you out of my clinic, and I don't deal with that. What I want to do is I want to change the standard of care, that the moment we meet a patient who has opioid use disorder, we begin treatment. And we'll talk more about these initiatives on this website and others as I work towards my goal of saving 1 million lives through opioid use disorder.